Hello. We're going to talk about liver failure and cirrhosis. So, how does a healthy liver end up in liver failure? Well, you first have a hepatic dysfunction. It could be prehepatic, intrahepatic, or posthepatic. Basically, we're not going to go through the etiology because that's someone else's wonderful ed talk, but you have these causes of hepatic dysfunction, and if we don't treat them or they continue to be an issue, you can get lipogenesis, leading to steatosis, which is fatty deposits in your liver. And as you continue to have these issues, not only can you get the steatosis, but eventually they can end up scarring your hepatocytes or your liver, and you can end up with fibrosis. So scar tissue is basically a fancy word for a fibrosis. Eventually, as you have more and more scar tissue, you have a decreased function in your hepatocytes, so you have decreased liver function, and you end up in liver failure. We're going to talk about cirrhosis. Basically, within cirrhosis, you have that scarring of your liver tissue leading to liver failure. There's different types. We're not going to go super in-depth into all of them, or we're going to be here for 30 minutes talking about it. But you basically have alcoholic cirrhosis, biliary cirrhosis, chronic hepatitis cirrhosis, and non-alcoholic cirrhosis. Alcoholic cirrhosis, this happens more in chronic alcohol use if you have more than 3 drinks a day. I think the main thing to remember about this is that AST-ALT ratio is greater than or equal to 2-1. So if your AST-ALT ratio is greater than or equal to 2-1, it is highly suggestive of alcoholic cirrhosis. Biliary cirrhosis, this happens due to destruction of the canaliculi, which is preventing bile from going down its normal path. So you get bile backing up into the liver, and as the bile accumulates, it can cause biliary cirrhosis. This commonly happens more in women aged 30 to 50, and it can be autoimmune components like lupus associated with it. Then you got chronic hepatitis cirrhosis. This is due to like a chronic hepatitis B or C infection. Usually with the current drugs, this doesn't happen as much, but in third world countries, they actually can still occur. God bless America. We have, finally, non-alcoholic cirrhosis. This is the most common type in the U.S. Due to metabolic syndrome. We have an increase of obesity, hypertension, and diabetes in America, so that can lead us to non-alcoholic cirrhosis. Again, that's the metabolic syndrome triad of hypertension, diabetes, and obesity. But it can also be caused by drugs like methotrexate use, chronic amiodarone use, and tetracycline antibiotics. Now let's talk about hepatic encephalopathy. This is due to hepatic byproducts building up in the brain. Your liver is no longer able to eliminate these products correctly. So they build up in your brain, causing level of consciousness changes, can cause issues with your fine motor skills, and it can also cause a telltale sign is asterixis, where somebody, when you tell them to extend their arms, their wrist starts to flap like they're waving goodbye or hello to you, whichever way you want to put it. Examples of these byproducts that can cause this are ammonia and bilirubin buildup. Another complication that can happen secondary to liver failure is hepatopulmonary syndrome. With this issue, you have the arterial hypoxemia. Basically, you have a lower oxygen concentration in your arteries. That can be due to a couple of reasons, but the main one is with the ascites, you're not able to get good lung expansion, so you're not able to exchange that oxygen. As well as this VQ mismatch that occurs due to chronic ascites, it can also contribute to that arterial hypoxemia. And remember from last quarter that pulmonary hypertension occurs because in chronic hypoxemia, the lung, instead of vasodilating, it actually vasoconstricts. So people with chronic hypoxemia end up with pulmonary hypertension. And finally, the ascites can cause not only the pushing up of your diaphragm, but it can also push up against the stomach and weaken your lower esophageal sphincter, and then you can end up with a huge risk for aspiration. So remember, people with cirrhosis, huge aspiration risk. Now let's talk about hepatorenal syndrome. This is due secondary to liver failure as well. It's basically a decrease in your kidney function. How that happens is that you have your sympathetic nervous system vasoconstricting, and you get decreased kidney perfusion due to that. And your kidneys are really finicky. They want a certain amount of perfusion, and when they don't get that, they get greedy and they secrete, they activate the RAS system. And the RAS system basically is going to reabsorb water and salt. Well, basically salt and then water kind of follows it. And that's going to cause more stress on the kidney and decreasing the glomerular filtration rate because it's going to damage the kidney more. And then you end up in renal failure. Thanks for watching. Hopefully, I know that was a lot, but hopefully it helped.